Welcome to the Sunday special on TopMedTalk. It's a potpourri of our favourite longer pieces, ideal for downloading and enjoying when you have a little bit more time. TopMedTalk.
Well, hello, I'm Desiree Chappell with TopMedTalk. I have been able to get four very special guests with me today, and I'm going to have them introduce themselves. So, Hillary, why don't you go ahead first?
Hi, my name's Hillary Burbage, and I am one of the Pets as Therapy representatives. We go and visit places. Some of them are places with people who are very terminally ill, very sadly ill, who perhaps are missing their pets and need some respite from the intensity of care that they're getting. So we bring that to their door. And some people we work with perhaps are not quite so unwell, but maybe they've been in hospital a long time, or they've been in care for a long time and need some downtime, need some therapy, need to stroke a dog and tickle a dog.
Just to get outside of their mind for a little bit.
Yeah, exactly. And I think, it and not only that, but it also brings enormous benefit to the staff, to the caring staff and the nurses and the doctors and all the people who are working so hard. It's a stressful environment, or potentially stressful environment, and it's a way of allowing people to just de-stress and chill. And seeing a dog or seeing a pet come into the ward or into a caring environment lifts the mood and makes everybody feel a bit better for a few minutes in their day.
Well, introduce your friend here.
Sure. Okay, well, this is Matlock. Matlock is my boy. He is very chilled at the moment, fast asleep at my feet. He's very fluffy and ginger. He's a Nova Scotia duck-tolling retriever, 4.5 years old, born in Wales. And so we live in North London, and we have been working with children with additional needs, so young people and babies with Down syndrome and a variety of learning difficulties, and some children with sensory deprivation issues, perhaps who can't see or can't hear but can feel, and to help relieve some of their anxieties. Yeah. I do a lot of work within my local church, and they have a special needs unit that works with the local community. So it was through there that I started, and the joy and the benefits I could see with families too. The group that I've worked with is called WAVE, and it's based in a church in North London, and they do a tremendous amount of support with families with children with additional needs. So I offer part of a service with that. They do all sorts of fantastic things with this family or families, and so that's how I started. And it's really wonderful to be able to see that feedback and to see how it lifts the mood and how children can interact with the animal. Yeah. And it makes all the difference.
Oh, and I love the community aspect that you guys have talked about, but then taking it into the hospital and realizing there are benefits. It's really interesting that you said that the nursing community is kind of taking hold of this, maybe first in the medical community. What are some of the benefits, I guess, maybe that nursing sees? They've seen immediate maybe differences with the patients. I mean, do you see differences in pain levels? Have there been any studies done?
There is scientific research actually that proves, in much the same way that walking in green fields and looking at blue sky has been documented and discussed, it is the same approach with an animal, and how your stress levels start to fall the moment you start to interact with an animal. And there are all sorts of Pets as Therapy animals. There are cats, there are dogs, there are all
guinea pigs. I've seen guinea pigs, bunnies.
There's also a horse, I think, I believe.
Oh, I did see that horse. Yeah. Oh, he's so beautiful. We'll put some pictures up. These dogs, it's fantastic. Not only does it lighten the mood for when you guys travel, to the hospitals and things like that, I think it's brought a whole new kind of feeling to the meeting here.
Yeah.
It does make everyone
smile, doesn't it? Yeah.
Everybody is.
Our booth has been bombarded with people who've come up to say hi to these lovely dogs.
Oh, yeah, you just can't help yourself. All right, so we have another guest here.
So I'm Suzy Emsden, and I've got my lovely pug Alfie with me today, and I lead a bit of a double life. So I'm a volunteer for Pets as Therapy with Alfie, and by day I'm a paediatric intensivist up in the northwest region doing paediatric intensive care transport.
Oh, that's fantastic. And how did you get involved with the Pets as Therapy volunteer group?
So we first of all got Alfie when my daughter was very ill, and found out he had an excellent temperament and was very calm and good at making people feel better. So when she was better, we wondered if we could make him help more people than just my own daughter. So we contacted Pets as Therapy and they sent us some more information, and we went through everything that they assessed for, made sure that he was ready to go, and then organised an assessment with our local assessor, and took it all from there.
Well, that's were you familiar with the program? Had you seen this type of therapy in the unit that you worked in?
I'd heard about it. No, I'd not seen it at work. I'd heard about it in other countries and wasn't even aware that it was going on in the UK, and did a bit of delving, and then discovered that there were over 6,000 dogs in the UK doing this, and cats as well, and very much wanted to be a part of it, and got involved very quickly and found it all very easy and unstressful. It sounds a bit stressful for your dog to have an exam, but it's more like a sort of meeting and seeing how they behave with people and how they behave in situations, and as long as they're like a 15 out of 10 good boy like Alfie, then they're absolutely fine.
He seems like he'd be a 20 out of 20. Cool dog. Well, you were saying that there's a process that the dogs have to go through and animals have to go through before they go into the hospital. I know that's a lot of concern for not necessarily just the hospital and the patients, but kind of everyone involved, that they might bring in an infection or something like that. So what is the process for the doggies?
So Alfie and I got together with the hospital that we visit, which is Manchester Children's Hospital, and we wanted to make sure, like you say, that Alfie's not bringing any germs in, and he's not picking up germs and taking them out. So the night before or the morning before a visit, Alfie will have a bath in Hibby Scrub, which is actually what surgeons use before an operation, but is also vet approved for use in animals. So we'll have a long soak him in a bubble bath, and he'll get shampooed with that. He has brand new clean uniform every time, so everything's been through the wash, including his harness, lead, badges swabbed, clean bandanas. I have a clean uniform every time, and then off we go to the hospital. He walks into the hospital, and then in the atrium he has his paws cleaned and sprayed with colloidal silver. And he has an antibacterial mouth gel. And on the wards we make sure that humans are bare below the elbows, and we don't go into anybody who's barrier nursed, either reverse barrier nursed or infectious. And if he's invited to sit on a bed, we get a clean towel per person, and we clean our hands and paws between every patient.
Yeah, that's great. He's probably cleaner than a lot of people.
He probably is, yeah. He probably is.
So they don't make people put that on their shoes, do they?
No.
If I may just take a picture, he's labelled. Is that a therapy dog? Is that just leave it there for a second? I just get picky of it. If that's all right.
Yeah.
That's.
He has a badge.
He has a hospital ID badge as well.
Can you put that next to his therapy dog? Look at that, it's brilliant. So, and is that the standard? Do all therapy dogs have a therapy dog thing like that?
I think it's up to you. So the bandana is his uniform and the little badge, and he's got his Pets as Therapy ID as well. The hospital very kindly provided him with a hospital ID so that he can make his way around and about without being stopped. And the little harness is just pugs up much better on a harness than on a collar. He has decorated that just so everybody knows why he's here.
I love it. He's like, wait, what's going on? I hear sirens. Yeah. So we have another guest here.
Yes, hi. My name is Pamela Pearl. I'm here with Frankie, who is 3.5 years old. She's a standard schnauzer. And we have been volunteering at Great Ormond Street Hospital for Children for just over a year and a half.
Oh, great. All right. I noticed her beautiful collar.
Of course, that's her work attire.
I like it. You dress up for work. Most of us usually are in scrubs and everything else. I like it. Brings a little fanciness to it. She has a nice studded, bright little jeweled collar. Yeah. That's great. So tell us a little bit more about what your work is that you do there. So do you work with a specific group, just the children?
So we go all over the hospital. We volunteer one afternoon a week at the hospital, and we go everywhere. We get requests to go up to see specific patients. We go onto every ward if there aren't any infection issues during that week or month or whatever. So that could be oncology, it could be intensive care, it could be a ward with cystic fibrosis sufferers. We also go into X-ray, outpatients, and, Great Ormond Street at any one time has over 500 outpatients, I believe, and, that covering the whole spectrum. So the patients might be in wheelchairs, might be blind, might have a number of different conditions, and we interact with them. If they express an interest to interact with Frankie, then, we, of course, make ourselves available. Most people do. I think there's a level of kind of getting patients who haven't, or their families who haven't been around dogs previously. There's an education element to what we do, and it really just the conversations just usually are about the dog, start with the dog, and then we sort of take it from there. And, I think most people have, there's an inherent connection with all animals. I'm a big believer that they have the potential to have a positive impact on people's health, be it physical, emotional, psychological, and that's, I guess, the main reason why I do this is because I wanted to do something practical for charity, and having done lots of fundraising in the past, and this was a way that I could do something with my dog,
Yeah, that's what I was going to ask, kind of how you got into this. Why was this something that you chose to do?
Well, it started from getting her, and we realized what a great personality she had, and because our kids are grown up, I thought it would be a nice thing to get her to do something with children, and hence us arriving at Great Ormond Street. So the process with Pets as Therapy is that all dogs are assessed, and if they pass the assessment, which basically tests whether or not they are calm, cool, collected, for want of sort of better words, then, and provided that they're, healthy and all the rest of it, then it's a question of just, I guess, finding the right fit for you and your dog based on the amount of time that you have at your disposal, the environment that you think your dog would feel most comfortable in, because every breed has got a slightly different sort of,
some don't like kids, some may like...
And so anyway, that could be schools, hospitals, it could be nursing homes, it could be, offices even. There's a huge range. We did something with university students, about a year and a half ago, sort of before their final exams.
Oh my gosh.
So that's kind of an interesting way of also involving the animal. And I've done some things. I've been in touch with a woman who heads up the nursing program at Middlesex University, and she was doing her PhD in the use of animal therapy as part of the national curriculum, nursing curriculum. So in the UK, it's, I guess, embraced in possibly a bigger way than it is in other countries. I'm not so sure about how widespread the use of animals in therapy is internationally, but I think here there seems to be a growing trend.
Yeah, I know in the U.S., the hospital where I worked for 10 years, we had a dog, and he kind of worked 9 to 5, Henry, and just the sweetest thing. And, he walked around, and immediately everyone, it's like a burst of...
smiling.
Start smiling.
Yeah.
It just kind of lightens the mood. It just brings something in that you just don't get when you're at work. And I think it's absolutely fabulous for the patient. We'll talk about some of the benefits that in just a second, but you're referring to the staff. Part of your day is that, you're just having a really rough day, and you walk down the hall and you see this cute little puppy, It's just the most wonderful thing.
Yeah.
We have another guest with us here who is with Pets as Therapy as well. Please introduce yourself.
Hi, so I'm Matthew Robinson, and I'm a National Project Coordinator for Pets as Therapy. So I work remotely, but essentially looking after various national projects and attending events like this on behalf of the charity.
Gotcha. So some of the questions that I think people would have is that if they're interested in having pet therapy within their facilities, like how should they go about that if that's not something that's kind of on a protocol for them or part of their process?
So what we're hearing is that some hospitals are very concerned, and rightly so, with infection control. We already visit so many, and each hospital has to be kind of dealt with as a separate entity, if you like. We have standard memorandums of understanding that have been drawn up in collaboration with the Cambridge University Hospitals Trust. We use it as a template, and we can work from there and then take on board anything additional that a particular establishment wants us to also do. For example, some might require all the volunteers visiting to be DBS checked, and that's something that they can certainly take up with the volunteer. We're happy with that. They may also have an induction process into the hospital, which, in collaboration with the volunteer, we can also arrange.
Very good. Pamela?
actually, the one person I know who's done a lot of work in this area and has validated research to support the impact that animals have on human health is a lady called Jenny Phillips. So she is based at Middlesex University, and if anyone listening is interested, I'm sure that if you go to their website, you'll be able to find out more. But she heads up the nursing unit there. So.
Yeah. Oh, that's fantastic. Well, so just for our listeners, can you tell us the best way to get, if they're interested in having pets into the hospital or wherever they are, the communities, obviously here in the UK, what's the best way to get involved? Well, first get in contact and maybe get involved.
Absolutely. Well, you can go online, you can go on Facebook, you can telephone the head office, speak to Pets as Therapy in your area, and there will be, I'm sure, a handful or a large, long list of volunteers with lovely, well-vetted animals that will be prepared to come in if they have time to come in and come into your unit and help in any way they can. So, yes, that would be the first port of call.
Okay. Great. Well, ladies and gentlemen, and thank you guys so
furry
much.
Friends.
I know, our furry friends. That's right.
Top Med Talk.
Nick Majerison here. Thank you for listening to Top Med Talk. Now, make sure you've subscribed to Top Med Talk on your podcatcher or however it is that you're listening to us at the moment. And you're spoilt for choice. We're on pretty much every single podcast platform you could think of. So make sure you've subscribed. Make sure you've engaged with us on social media, Twitter, Facebook, LinkedIn, YouTube. And make sure you've signed up for our email updates on topmedtalk.com. If you get yourself there, you'll find a website that contains all of the podcasts that we've ever done, and it gives you the chance to sign up for our email updates. That way we can always get in touch with you and tell you what we're up to. Oh, and while you're online, check out ebpom.org/meetings. While you're there, get excited about EBPOM London 2019, the London Perioperative Medicine Congress. It's on July the 2nd, and it's one of many meetings that EBPOM organises around the world in order to communicate the perioperative medicine message. Have a look, ebpom.org/meetings.